Welcome you all. My name is Dr. PJ Madam Duffy. Today we are going to discuss about gonadotropins and gonadotropin releasing hormones. Okay. So first of all, what is gonadotropins? Gonadotropins examples will be follicle stimulating hormone, luteinizing hormone. Both are known as gonadotropins. Okay. They are secreted from the anterior pituitary hormone. So what are the actions of follicle stimulating hormone? First we will see FSH. Follicle stimulating main action will be spermatogenesis and estrogen secretion. Next, luteinizing hormone main actions will be ovulation, progesterone secretion, testosterone secretion. Okay. Next is deficiency of these gonadotropins will land up patient leads to anovulatory infertility in females, oligozoospermia in males, infertility in both, and hypogonadotropic hypogonadism. Okay, so these are the complications when patient will have deficiency of gonadotropin will causes. Okay, next is when patient is having excessive secretion of gonadotropins, patient will have precocious puberty because excessive secretion of LSH and FSH will lead to cause precocious early puberty, and endometriosis because of more hormones will be get produced, so more endometriosis will be there. Then prostatic carcinoma will have chance, then more fibroiding having chance, then polycystic ovarian disease will be there. Because of excessive secretion of gonadotropins, patient will have chance of developing these complications. Okay. Next is gonadotropin releasing hormone analogs. Examples of gonadotropin releasing hormone analogs will be buserelin, goserelin, leuprolide, nafarelin, hysterelin, triptorelin. Okay. So these hormones or these analogs will be administered by two different mechanisms. One is if you are administering in continuously, they will have different response. If you are administering in non-pulsatile manner, they will have different response. Okay. That is pulsatile manner and non-pulsatile manner. First we will see if you are administering these drugs as a pulsatile manner. Pulsatile means if you are injecting drugs and in a pulse manner, that means once a spike, then you will give some gap, then you administer drug, then you will give some time period, then after that you will give inject drug, then you will give some time period. Like that gap will be there. That is pulsatile manner will be there. Non-pulsatile means continuously administration of drug. Okay. So if you are administering in a pulsatile manner, that means if you are injecting drug and giving some time lag. Okay, that time that if you are giving drugs like that pattern, so though it will lead to cause increasing of luteinizing hormone and follicle stimulating hormones. So obviously there will be more gonadotropins will be released. So there will be more elevation of sexual hormone. Those are estrogen, progesterone, and testosterone. Okay, so if we are using these hormones as this pulsatile manner, so what are the therapeutic use where you can use these conditions? Anovulatory infertility condition will use, and delayed puberty condition will use. Because of in anovulate infertility there will be no ovulation will be there because of lack of this one estrogen progesterone hormones. Okay, so when you are giving this in pulsatile manner, there will be more production of LSH, LH and FSH will be there. That means follicle stimulating hormone will be rise, luteinizing hormone will also rise, leads to cause more production of estrogen progesterone. There will be more proper ovulation will be happen. Okay. Next is delayed puberty condition also will use. Okay. Next manner is non-pulsatile manner. Okay, non-pulsatile means this here the drug is administration continuously. Okay, there will be no gap will be given. Continuous administration will be there. So leads to cause decrease in LH and FSH. That means decrease in luteinizing and follicle stimulating hormone. There will be obviously decreasing in LH and FSH, leads to decrease in production of all three major hormones, that is estrogen, progesterone and testosterone. Okay. So these non-pulsatile manner will be useful in which conditions? That is prostatic carcinoma, because where we will have more excessive production of hormones. So in those conditions we have to suppress by giving pulsatile manner, this non-pulsatile manner. Okay. Next is endometriosis condition. Next fibroid condition. Next precocious puberty condition. In these four conditions we will administer these drugs as non-pulsatile manner. That means continuous administration will be there. So when you are injecting continuously, obviously they will suppress LH and FSH. So thereby they will cause decrease in production of estrogen, progesterone and testosterone. Okay, thereby they will controlling the diseases of these pathologies. Okay. Next is gonadotropin releasing hormone antagonist. Okay, so gonadotropin releasing hormone antagonist will also, they will be lead to decrease follicle stimulating hormones and luteinizing hormone, thereby decreasing production of three hormones, that is estrogen, progesterone and testosterone. Okay, because these also have similar mechanism of non-pulsated manner only. That's why they will use similar, like non-pulsated uses also similar, because they both will be inhibiting luteinizing and follicle stimulating, finally land up in decreasing of three major hormones. Examples is main important, that is cetrorelix, GnRH, aberrelix. If you are seeing gonadotropin releasing hormone, they will land up with relin, that means they will releasing hormone. Here if you are observing, it is relix. Relix means X, the end up with X. X means their inhibitory hormones. Okay, so you have to remember, if you are land up with ending with N means relin means it is releasing. Relix means it is inhibiting. Okay, you have to remember that thing. Next, adverse effects of this gonadotropin releasing this antagonist will be flare up reactions will be there. Those are hot flushes, loss of libido and osteoporosis. So these are the major adverse effect. So here we have to remember is, main thing is gonadotropin releasing hormone will land up ending with relin. So gonadotropin releasing hormone antagonist will be land up with relix, cetrorelix, GnRH, aberrelix. Okay, so you have to remember that major difference between relin and relix. Okay, that's all. Thank you.